benzodiazepines for alcohol withdrawal, methadone as a substitution for opioids. These are well-established treatments. But what about methamphetamine withdrawal? Today we'll discuss the research into amphetamine as a potential treatment for methamphetamine withdrawal. Hi everyone, I'm Dr. Sanil Rege, consultant psychiatrist, and welcome to Psychiatry Simplified, the channel where we cover all things psychiatry, neuroscience, and mental health related. So if that's your thing, don't forget to subscribe to our channel to stay in touch with all the future releases. So let's get started. Today we're delving into a topic that's generating significant interest in the field of addiction psychiatry. Can amphetamine, specifically Lisdexamfetamine, also known as Vyvanse, help in methamphetamine withdrawal? Let's explore this intriguing possibility. We know that methamphetamine, a potent central nervous system stimulant that blocks serotonin transporter, noradrenaline transporter, and dopamine transporter, thereby significantly increasing levels of these neurotransmitters within the synaptic cleft. Now we know methamphetamine can result in significant addiction. I've covered methamphetamine and its effect on the brain in quite a few videos here and here, so don't forget to check these out. So with methamphetamine being such a potent stimulant, cessation of long-term methamphetamine use can result in a significant withdrawal syndrome. This is characterized by a dysphoric, unpleasant mood and at least two of the following symptoms: fatigue, vivid or unpleasant dreams, insomnia or hypersomnia, increased appetite, and psychomotor changes. These psychomotor changes could be agitation or slowing down as well. The withdrawal process includes an initial crash phase. This lasts approximately 12 to 24 hours and is marked by exhaustion and fatigue. Subsequently, this is followed by a withdrawal phase lasting approximately 2 to 4 weeks, with symptoms peaking in the first 7 days. This is followed by a protracted phase known as the extinction phase. This can last approximately 6 to 12 months, and it involves cognitive deficits and a range of affective symptoms. And what we mean by that is a range of mood symptoms. This could be emotional dysregulation, feelings of depression, or hypomania or mania as well. The severity of the withdrawal symptoms itself poses a high risk of relapse, and therefore treatment of methamphetamine withdrawal becomes crucial to cessation of methamphetamine in the future. Now, like alcohol withdrawal or benzodiazepine withdrawal or opioid withdrawal, for methamphetamine withdrawal there aren't any approved pharmacotherapies. In the absence of clear evidence, treatment guidelines recommend supportive care and cautious symptomatic management with medications such as diazepam, a benzodiazepine, or anti-agitation agents such as olanzapine. At the same time, there isn't significant evidence for these two options that I mentioned. This gap in treatment makes it really important to explore other treatments that might be beneficial in methamphetamine withdrawal. And one such alternative is Lisdexamfetamine. So this brings us to an important study where Lisdexamfetamine has been explored. So firstly, what is Lisdexamfetamine? I've covered Lisdexamfetamine in this video here on the difference between amphetamine and methylphenidate. Lisdexamfetamine is a prodrug of dexamfetamine. And what that means is when Lisdexamfetamine is administered, it's hydrolyzed in the blood to its active form, which is dexamfetamine or dextroamphetamine. This conversion occurs in the red blood cells. The difference between dexamfetamine and Lisdexamfetamine is that Lisdexamfetamine has a longer duration of action, and at the same time it does not have this rapid potent release that amphetamine or methamphetamine has. It lasts for up to 13 hours. So let's look at the study. This study was an open label, single arm study. Open label essentially means that one party knows what medication they're receiving. In this case, the patients most likely knew whether they're receiving Lisdexamfetamine or the comparator. This study included 10 adults who were diagnosed with methamphetamine use disorder, and they were treated with a tapering dose of Lisdexamfetamine in an inpatient setting. The starting dose was 250 milligrams of lisdexamfetamine, and this was reduced by 50 milligrams each day. Their withdrawal symptoms were monitored daily for 7 days, with a subsequent follow-up after 21 days. So what were the results? The results were actually quite promising. 8 out of the 10 participants completed the treatment. Now, whilst there were some adverse events, these were all rated as mild in severity. Importantly, patients reported a 100% satisfaction rate at treatment completion, and both withdrawal severity and cravings decreased significantly during the treatment. So sounds really promising. However, this is a small study and of course is an open label study. Nonetheless, it tells us that further research, particularly large double-blind randomized controlled trials, could really help us decipher whether lisdexamfetamine shows potential in methamphetamine withdrawal. Now, surprisingly, this is the only study that's looked at lisdexamfetamine in methamphetamine withdrawal. However, there is also interest in the use of lisdexamfetamine to serve as substitution therapy. Just like methadone is used as substitution therapy in opioid dependence, lisdexamfetamine may show potential here. This agent could potentially provide a safer alternative to methamphetamine, reducing cravings, withdrawal syndromes, whilst at the same time minimizing the risk of misuse and all the other medical and psychiatric complications that come with methamphetamine use. Whilst the study we spoke about earlier focused on withdrawal, there is a study known as the LIMA study, L-I-M-A, where lisdexamfetamine is being studied for methamphetamine dependence. Now, this study began sometime in 2018 and the results aren't out yet. So it's going to be interesting when the results finally come out. So here's what we know. In this trial, the maintenance dose of lisdexamfetamine is 250 milligrams. A statement that was really intriguing is that this dose has been well tolerated in non-methamphetamine dependent volunteers, so a dose of lisdexamfetamine at 250 milligrams, but also in participants with schizophrenia receiving antipsychotic treatment. Additionally, a recent dose escalating trial with high-frequency methamphetamine users successfully escalated most participants to 250 milligrams of lisdexamfetamine. What it's telling us is the safety of this agent in a high-risk group. Now, it's likely that the LIMA trial is going to give us a lot more information because this is a double-blind randomized control trial 1, and the sample size is also larger, 180 participants. So something on the horizon with regards to methamphetamine dependence. So to summarize, substitution agonist treatments like lisdexamfetamine aim to replace harmful substance use with safer treatments, similar to how we use nicotine replacement therapies or methadone in opioid dependence. Long-acting agonists such as lisdexamfetamine may potentially reduce the withdrawal symptoms, cravings, the reinforcement from methamphetamine, thus providing a framework to ensure cessation and psychosocial recovery. Thus, whilst we're in the early stages of understanding the potential of lisdexamfetamine for withdrawal and dependence, there are some encouraging results, of course, with the open label trial for withdrawal and results to come for dependence. This could mark a significant step in the treatment of methamphetamine dependence, providing hope for individuals struggling with this devastating addiction. Thank you all for listening to me today. If you found this video useful, don't forget to hit the like button and of course subscribe to our channel to keep in touch with all our future releases. A big thank you to all of you for supporting this channel. It means a lot to us. If you've got any comments, don't forget to leave them on the comment section and let us know what other videos you'd like. I look forward to seeing you in another video soon. Until then, stay curious. Bye-bye.